So all pregnancies end. 60 to 70% of them are estimated to end in a live birth. That's lower, actually, in non-Hispanic Black women. Another 20 to 25% are estimated to end in a natural loss. And the two I'm going to talk to you about today are miscarriage and ectopic pregnancies. And then finally, another 20 to 25% end in induced abortion. An intervention using abortion drugs or surgery with the intention of the pregnancy not resulting in a live birth. So my name is Dr. Susan Bain, aka Dr. Pink Glasses. I, like Stephen and Sarah, have been tasked with changing your mind, or perhaps providing confirmation why you don't need your mind changed. I've actually been able to listen to their talks and have loved listening to what they have had for their particular question. Now, the one assigned to me is this one. Is miscarriage care an abortion? So as we start our short time together, I want to first acknowledge that abortion is a hard topic, a really hard topic. I recognize that there are likely some here today who've been deeply touched by abortion, either directly or indirectly. My intention in my words is not to cause harm, though there may be some pain in this topic. Carrying the load of abortion can be heavy, and it's all too common in our country when approximately 1 in 4 women in America have had an abortion by the age 45. Now, on June 23rd, 2022, the Dobbs decision was issued. Roe was gone, but chaos ensued. Now, sadly, this chaos was actually rooted in my own profession of obstetrics and gynecology. As I reflect on what happened the past 2.5 years post-Dobbs, I want to say I'm sorry on behalf of my profession. If any of you are sitting here today and are confused about the question, is miscarriage care an abortion? You know, the purpose of medicine is health, healing, and wholeness. My profession is causing just the opposite. It's causing harm at so many levels. And I am here today to right that wrong. I'm here representing the American Association of Pro-Life Obstetricians and Gynecologists, a medical organization that consists of more than 7,500 members with a mission to equip and encourage our members who want to practice life-affirming medicine to do so. Now, ACOG, we are the second medical voice to an organization called ACOG, the American College of Obstetrics and Gynecology, my own profession's largest medical organization, who has become, sadly, an openly partisan wing of the abortion lobby at the expense of both of my patients, moms and babies. They just put out this ACOG committee statement on increasing the need to access abortion. They contradict themselves repeatedly in defense of pro-abortion policies, and they deny basic scientific truths through linguistic shifts or change in language. These are excerpts, actually, from their guide to language and abortion. Here's one of the things they state. We, as doctors, should not use the term heartbeat. It should be replaced with cardiac activity in all our documentation. They also state we shouldn't use the term baby or unborn child or preborn child. Rather, we should use scientific terms like embryo and fetus. Now, those are correct terms, but most of the patients I see don't have a medical background. So I use lay terms all the time. If I'm prescribing one of you all a medicine that needs to go under your tongue, I'm not saying you take it sublingually. I'm telling you, put it under your tongue. If you have a heart attack, I'm going to tell you, I think you've had a heart attack, not you've had a myocardial infarction, even though that might be the scientific term. And when women call us and say, I'm worried my baby isn't kicking as much, They don't call us and say, my fetus isn't kicking as much. The goal of ACOG is to dehumanize the developing embryo, the developing fetus, the developing baby. And no one in medicine should stand for it, and neither should any of you. Now, here's another statement they have. This is called Understanding ACOG's Policy on Abortion. They released it in September 2023. The purple bullet here says, people should be able to access abortion care where and when they need it, including for such purposes as abortion care, miscarriage management, and perinatal palliative care. Do not fall for their change in language. It is a woeful attempt to imply abortion is health care. I never use the phrase abortion and care next to each other because the direct and intentional killing of an innocent human being is not health care. Yeah. Second, miscarriage management and perinatal palliative care. Perinatal palliative care happens when a woman is pregnant, her baby is diagnosed with a potentially life-limiting condition, and it's kind of like hospice during pregnancy and after pregnancy. Miscarriage care and perinatal palliative care are not abortions, yet ACOG wants to call them abortions post-obs. Why? Because ACOG is trying to broaden the definition of an abortion post-obs so that exemptions in legislation that protect children before birth can include diagnoses that do not and should not ever be treated with abortions. So with that context, let's go back to my first slide and answer this very simple question. Is miscarriage care an abortion? The answer is simply no. It was not pre-Dobbs, the 50 years of Dobbs, or post-Dobbs. This intentional chaos you may be feeling is negligent, and that negligence is sadly leading to real harm. Real harm to women who have names like Amber Thurman and Portia Gumezi. Both women died. Their deaths were likely preventable. And unlike the journalists that reported about them, and ACOG's new campaign they just launched called Blame the Bans, that blame pro-life legislation for their deaths, there are no laws in any of our 50 states that prevented these women from receiving the health care they needed and should have had. Now, last Saturday, I went to the People's March. The Women's March is now the People's March. I went with Dr. Christina Francis, the CEO of APLOG. We went with the Daily Signal. And I had a great conversation with this woman. She actually had a miscarriage over 20 years ago. She had to have a D&C procedure. And she told me that women today post-Dobbs couldn't have the same procedure and would die. The video guys are going to show just a very short snippet of how our conversation went. I'm really sorry you had a miscarriage. Now, so your baby had died?
Yes.
Okay, and so the doctor had to do a D&C?
Correct.
So did you know in Texas that actually could have, you could still have that procedure? So, short snippet, but let's set the record straight and take away any confusion you may have. So in medicine, the term abortion is actually an umbrella term. It's defined as a loss before 20 weeks gestation. So in my practice, if a woman calls and she is bleeding, cramping, I do an ultrasound and everything looks fine, she's actually got what's defined as a threatened miscarriage, or we document actually a threatened abortion. She calls back and says, my bleeding got worse. We do another ultrasound and her uterus is now empty. She's had a miscarriage. She's had a spontaneous. abortion. Now, if she's in the middle of that process, it's called an incomplete abortion. She's not finished emptying her uterus, or an incomplete miscarriage. If she's already completed it, we call it a complete miscarriage or complete abortion. That is completely different than the last thing on this slide, an induced abortion, which is what Roe and Dobbs and the law is all about. So how does the Center for Disease Control define induced abortion? I'm just going to highlight a few pieces of this. A legal induced abortion is defined as an intervention performed by a licensed clinician that is intended to terminate a suspected or known ongoing inside the uterus pregnancy, and that does not result in a live birth. So the purpose of that intervention is to produce a dead baby. So the truth is this: miscarriage care is not an abortion. Pro-life legislation in all 50 states allow women with a miscarriage to receive the medical care they need. Now, what also is an abortion, an induced abortion, is a tubal or ectopic pregnancy. So look at the top graphic. Conception occurs in the fallopian tube. A woman has two of them, one on each side of the womb or uterus, and the embryo takes actually about a week to travel to the uterus and implant there. Now, sometimes that process fails and ectopic pregnancy occurs. It's often called a tubal pregnancy because the tube is the most common place it occurs. Now, the bottom picture shows laparoscopic surgery that I might do for an ectopic pregnancy. The blue arrow points to the uterus or the womb. The white structure is an ovary with the fallopian tube on top of it. The red arrow points to an ectopic pregnancy in that fallopian tube. So there's an embryo in there. The dark fluid you see is actually blood. This situation is particularly dangerous. It's the leading cause of death in the first trimester for pregnant women because that tube can actually rupture and fill that entire abdominal cavity with blood. Treatment is not by an induced abortion. Treatment is by medication or surgery. So, the truth is, ectopic pregnancy care is not an induced abortion, and pro-life legislation in all 50 states allow women with an ectopic pregnancy to receive health care. Now, I want to tell you about one other situation that's been in the news a lot lately. And this is when we have to separate our maternal and our fetal patient before we really want to because of a pregnancy complication. It is important for you to know that is also not an induced abortion. There have been many news stories that blame pro-life legislation on denying women care when they have pregnancy complications. One story involved Chrissy Teigen and her husband, John Legend. This is what the headlines read. Chrissy Teigen reveals late son Jack died in life-saving abortion. Let's just call it what it was. The bottom one says, Chrissy Teigen opened up about her devastating pregnancy loss, revealing she needed medical intervention to stay alive. Chrissy did indeed need a medical intervention to stay alive, and it was an induction of labor in which her son Jack was delivered early. It was not an induced abortion. The intention of our intervention in a case like that is not to end Jack's life. Rather, it's to stop her hemorrhaging, which is her situation, by separating her and her baby. If Jack's life could have been saved, it would have been. Sadly, the unintended consequence of inducing labor, separating them early when he was too young, meant he would not survive. However, if he had just been a little bit older, he may have been able to go to the neonatal intensive care unit, the NICU, and receive health care and hopefully survive. So the truth is, the premature separation of maternal and fetal patients is not an induced abortion. all 50 states allow this to happen. Probably the most important slide you'll see is this one. Intention matters. So remember that CDC definition of abortion? What was the purpose of the intervention? To not have a live birth, to produce a dead baby, okay? If we're doing interventions and our goal is not that, but our fetal patient dies unintentionally, that is not an induced abortion. So to summarize that comparison, miscarriage and abortion, they are not the same. A miscarriage is a natural loss. No intervention has occurred. An induced abortion, there is an intervention. A miscarriage, how do we manage it? Well, actually, we can do it in one of three ways. We can do it expectantly. If we do nothing in a woman who's in the middle of a miscarriage, about 80% of women in a 2-week span will actually empty her uterus naturally without us doing anything. If that doesn't happen, we do have medications and D&C surgeries we can do. Look at the other side with abortion. You do not see expectant management because guess what? If we do nothing, remember 60 to 70% chance we've got a live birth. So the only way that you can have an induced abortion is if something's done, abortion drugs or surgery, a D&C. And then finally, I just want you to know that there are emotional consequences that go with all reproductive loss. As I close, I want you to look at this picture. I want you to feel the emotions of this woman. They are real, they are raw, and they are devastating. She suffered a great loss. But what you can't tell by looking at that picture is what type of loss has she experienced? Has she had a miscarriage? Did she have an ectopic pregnancy? Did she have a premature separation where we had to move towards delivery early? Her baby was too young to survive? Or did she have an induced abortion? All reproductive loss comes with emotional consequences, including trauma for many. If her loss was indeed an abortion, she does not need our judgment or shame. She needs our love. You see, while she may say she doesn't regret her abortion because of the circumstance she was in at the time she made that decision, regret and trauma are very different. Think about someone who puts on a uniform to serve in our country. He or she likely doesn't regret that. But then think about what he or she sees or does as part of their job. We all know the term PTSD, post-traumatic stress disorder. So you can have no regret and still have trauma, particularly when 63% of abortions in 2023 happened using abortion drugs, where women and girls were in their homes, their dorm rooms, their apartments, and their bathrooms became abortion clinics. And every time they go back in there, they're reminded of the trauma they experienced there. So, my challenge to you as the next pro-life generation is while you fight for babies, please do not forget her. Love her. She has an entire lifetime to heal. Thank you all.